Okay, Caroline, this is part 2. I'm going to try not to go off on any tangents. Okay. And I'm helped by the fact that I watched a documentary about this guy since I've talked with you. I'll learn something. Wakefield tells Bradley, although he would not give his own children the single MMR vaccine, he would vaccinate them. He would vaccinate them each disease individually? Isn't it he would vaccinate them against each disease, I think? Despite it being cost-effective in public health strategies, by having this 3-for-1. Despite it being cost-effective. This next part I don't understand. And public health strategy. I think what you mean is despite it being cost-effective to have 3-in-1 for public health purposes. You need to fix that. Okay. Wakefield believes this combination is what makes MMR so potent. Bradley also conducted interviews with other vaccination specialists and physicians who counteract both claims made by Wakefield and the Wildmans. No apostrophe. The segment watched by millions did resonate among those who have had traumatizing experiences with vaccinations. Also, the question arose in many families of whether to risk vaccination after hearing of these horror stories of the MMR vaccine ASD. There has been research and countless studies over the past years that say that MMR does not cause autism. Many Western countries, including the United States, with advanced medical and scientific programs, have conducted series debunking the correlation between the MMR vaccine and autism. Based on the countless epidemiological studies, not only was the MMR vaccine proven to be just as safe as separate vaccinations for each disease, but that autism is a genetically predisposed disorder. A study conducted in Denmark, the Danish Epidemiology, I'm really proud of how well I pronounced that, Science Center, studied about 600,000 children, in which they all received the MMR vaccination. So because you've already explained what you're referencing here, you don't need to put it in parentheses. Okay. Of the 600,000 children who received the MMR vaccine, only 316 children were diagnosed with ASD, giving a confidence interval score of 0.83, which proved that the MMR and autism are not correlated. I think you have to have, it has to be, the closer to 1 it is, the more it's correlated, but I'm not sure. It's been a while since I worked in stats. Despite the broadened diagnosis of autism, the Danish Epidemiology Science Center stated there was no sharp increase in the prevalence of autism after the introduction of the MMR vaccine. Okay, another little paper writing thing. You don't need the ... at the beginning because we know that there are things you've cut off of the beginning. That's assumed. That by inserting a quote, we know there's probably stuff before it, unless it's the very beginning, and there's stuff after it. So you can just jump into, they stated there was no sharp increase. Okay. And again, you don't need more stuff in parentheses because we know where to look. You've told us where to look if we want to see this source. We need to look at the Danish Epidemiology Science Center. It's kind of a tongue twister. Okay. Even though some areas of the world, such as California, did see a prevalence in the number of cases of autism, it was observed well after the introduction of the MMR vaccine. Although the Danish Epidemiology Science Center was missing data based on those children who are vaccinated being vulnerable. It was missing data based on children who are vaccinated being vulnerable due to a genetic history of ASD. Hey, since the risk rate was less than 1, seems like I was right, it wouldn't support that there is a subgroup of children that are at risk. I do not understand what you're saying there. Which might just be me, but... You lost me! Can you fix that? The statistical analysis and careful review of MMR vaccines within Denmark helped to support that the causal relationship between autism and MMR vaccine is non-existent. In 2002, the New England Journal of Medicine published a perspective piece by Dr. Edward Campion, the current editor for that thing, and physician in geriatrics, acknowledging the reason for the association between autism and MMR. Geriatrics, huh? I'm not, why is he the one talking about vaccines and autism. Okay. Campion does state that vaccines can cause serious adverse reactions and continue to provide examples, such as the live polio vaccine, which can cause paralytic disease in recipients. Even though there are some that have concluded the measles component causing encephalitis, even though there are some that have concluded the measles component causes encephalitis, which causes ASD. I think maybe that's what you mean. Campion strongly supports multiple studies, including the one by the Danish Epidemiology Science Center, that activism, he supports the studies. I feel like that's not how they say it. He finds the studies credible, maybe? He finds the studies, I don't want to say believable, but while the scientific data, Campion does acknowledge that families aren't going to trust vaccine manufacturers, the government, and medical establishment, as well adding on recent incidents in which vaccines containing mercury now removed were found in vaccines. What? There were many implications. Okay, that's another sentence you're going to come back to, because it's tangled up. Okay, those that are immunocompromised, such as the elderly, I don't think you want to say elderly community. I think you can just say such as the elderly. And those with underlying illnesses are being put at risk when a parent decides not to vaccinate, essentially putting their community at risk. As groups of anti-vaxxers spread their messaging around playing it safe by not vaccinating their children, Campion says they forget how bad the illnesses and their complications can be. They forget that in this country, before the development of the measles vaccine, thousands of children had severe illness from measles, sometimes resulting in permanent disability. Campion urges readers to think twice before deciding to not vaccinate their children, but look at the science before giving in. Giving in? I might say before deciding. Giving in doesn't sound like a very negative thing to do. Okay, all in all, it has come down to the final question, should I vaccinate my child? Despite countless scientific research proving there is no causal relationship between autism and MMR vaccination, no parent wants to take that risk, even if the risk is a hoax itself. Vaccines have provided a tremendous expansion of healthcare. An expansion of healthcare? Especially the immunocompromised, as they will no longer suffer the ill fate that comes with measles. I mean, they haven't provided an expansion. I guess they have improved health outcomes, maybe? The research, education, and findings behind autism have helped tons work through their disorder, learn to cope, and work on their behavioral issues. But like any spectrum, there are kids on both ends, high and low. There is going to be a time in the near future in which a novelty vaccine will be hitting doctors' offices around the United States. Yep. Novelty vaccine? I think you mean a new vaccine. Like the coronavirus vaccine? I think is what you're saying. And many parents will have to decide whether or not to vaccinate their children. Oh, God. Okay, yeah. I'm just not going to think about that anymore right now. Okay, your works cited, as I'm looking at it, looks good. You got lots of sources. Okay. Enjoyed your paper a lot. I hope that's some helpful feedback.